Breaking the Darkness, the podcast that reviews the research on mental health concern in educational context. My name is Ian. I'm a teacher with extensive practice in various schools across Kenya, and I'm currently employed in Southport State High School, a school in Australia. Today, we are dealing with an important topic that is currently relevant to Aboriginal Australian adolescent population: depression. According to the statistics, the picture is rather grim. The Australian Aboriginal and Torres Strait Islander youth report higher levels of psychological distress than non-Indigenous youth, as the Australian Institute of Health and Welfare reported. Currently, 33% of Aboriginal young people indicated high or very high psychological distress, as opposed to 14% of non-Indigenous young people. These disparities are not being felt in isolation. They are immersed in racially charged landscape of intergenerational trauma, institutionalized racism, and economic marginalization. In school settings, this mental health challenge leads to poor attendance, decreased academic participation and achievement, and fewer chances for these youth to succeed. We are educators and mental health practitioners, and we have an opportunity to employ practical approaches that can positively impact people's lives. In this context, the field of positive psychology presents more effective strategies as they focus on strength-based models rather than deficit-based frameworks, which have previously been used on minority groups. In today's post, I'll be presenting a summary of 3 recent rigorous research studies on positive psychology interventions that could help with depression in Aboriginal Australian adolescents. We will discuss how these approaches can be implemented in schools and examine the theoretical and empirical evidence. Article 1. A systemic review conducted by Ponturo and Kilcullen in 2021 to interrogate the disparities in Aboriginal and Torres Strait Islander communities' mental health support identified the existence of a mismatch in psychological therapies used as populations they served. The psychological therapies employed failed to recognize the indigenous concept of social and emotional well-being varied from one community to another. In this case, these concepts were embedded in the values of community, spirituality, and connection to the country, elements that did not directly correlate with Western psychiatric frameworks frequently imposed in Aboriginal societies. Consequently, the authors evaluated the cross-cultural validity of psychiatric intervention bridged across this population. This review employed a PRISMA framework where it identified 12 eligible studies that cited psychiatric therapy interventions such as cognitive behavior therapy, CBT, acceptance and commitment therapy, ACT, multisystemic therapy, MT, and narrative therapy, NT, deployed across indigenous communities. The most commonly reported approach was CBT, despite the aspects of justifying frameworks for its implementation in disparate scenarios. The prevalence of CBT across these studies reflects its ambiguity in Western psychology without presenting similar bespoke interventions suited to indigenous communities such as Australian Aboriginals and Torres Strait Islander populations. This review emphasizes the limitation in scope and applicability of most studies addressing mental health interventions such as NT and ACT among indigenous populations. Consequently, this suggests that despite the potentially promising outcomes created by such modalities, there is a little research conducted on their utility in managing mental health in indigenous contexts. The authors identify this challenge as inadequacy in cultural interfacing, where many mental health interventions are implemented in communities that are detached from the acceptability and appropriateness. Consequently, Ponturo and Kilcullen in 2021 called for redirection of attention among psychological health researchers and practitioners towards finding empirical data that transcends an outcome orientation and consequently addresses the cultural congruence of implied health intervention. Its finding emphasizes the critical epistemic gaps that require agent reimagination to resolve mental health disparities from indigenous worldviews. Article 2. The second study that this podcast explores is one written by Robinson et al. 2022 on the validity and reliability of resiliency measures trialed for the evaluation of a preventative resilience promoting socio-emotional curriculum for remote Aboriginal school students. This study evaluated a measurement of psychological resilience and their contextualization among Aboriginal adolescents. The researchers contribute to a larger collective on socio-emotional learning in Northern Territory in a program called Skills for Life, which sought to contextualize mental health intervention to the needs of learners in such communities. The study used the Connor-Davidson Resilience Scale (CDRISC) to evaluate individual psychological resilience among Aboriginal children. This measure analyzes the analyzes an individual's inner strength by gauging their capacity to bounce back from stress. However, the researchers questioned whether the statistical and cultural measures used in this study actually fit into the context of Aboriginal youth living in remote areas. So, the researchers brought together a study sample comprising of 257 Aboriginal secondary school students from ages 12 to 18, all of whom participated in the Skills for Life program during the school days. The students completed mental health assessments, including the CDRI SC10 student Kessler scale and a psychological distress scale to gauge emotional and behavioral difficulties. In evaluating the efficacy of CDRIC, the team discovered that the link between distress and resilience disappeared among students who handle moderate to high levels of adversity. Consequently, this measure could only predict emotional strain with a level of accuracy within a low adversity settings. For students such as those in this study who have significantly pressurized lives, these tests may fail to identify resilience in their day-to-day scenarios. The barriers in language and cultural framing do more to decrease the reliability and validity of such tests. The researchers identified a critical difference between Western and Aboriginal models for resilience in their findings. These results emphasize the importance of finding better tools to measure resilience in methods that reflect cultural identities of societies that utilize best practice recommendation from Western psychiatry. This study is a powerful reminder of the diversity in psychological traits such as resilience. In some societies, resilience means staying calm, while in others it means bouncing back easily. However, in some communities, like those cited in this research, resilience means holding a heavy emotional weight without feeling the need to unburden oneself. The strength these communities draw from cultural identities and collective experiences are a vivid representation of this meaning of resilience. Article 3. The final piece of research consulted in this episode is the study by Flies et al. 2023 titled Bridging the Evidence Gap, a review and a research protocol for outdoor mental health therapies for young Australians. This piece of research introduces a refreshingly novel set of interventions drawn from positive psychology to be implemented among Aboriginal and Torres Strait Islander youth with higher levels of cultural congruence and likelihood of resilient support systems. This work is particularly significant in this analysis as it responds to system-level concerns that many conventional psychological schools of logic ignore. How can mental health interventions grow into readily accessible, sustainable, and culturally attuned solutions for our predominantly young Aboriginal communities? The authors elaborate that approximately 40% of all young youth aged 16 to 24 experience mental health disorders annually, with a small proportion seeking professional help. These statistics are indicative of barriers such as cost, a strong aversion to institutional environments, and distrust of mental health professionals, particularly when contextualized to Aboriginal and Torres Strait Islander population who live in rural and socioeconomically marginalized areas. Beside this, Beside this end of the dynamic being stretched, the mental health system itself is under a lot of pressure to deliver outcomes with endlessly patient waitlists. These scenarios create burnout and overexertion among the mental health practitioners, much to be detriment of their practice. Outdoor therapeutic interventions implemented through activities such as guided walks and semi-structured group conversation in natural environments have considerably potential in fulfilling the objectives of positive psychology. Rather than visualizing these activities as conversations, the study designs them as multidisciplinary interventions that introduce change through multiple mechanisms. The non-clinical setting in such ventures diffuse the attention of fostering socio-economic connection in patient environments. On the other hand, the calming effect of nature supports emotional regulation to allow room for therapeutic dialogue. The group context is implemented in this intervention support the inclusion of Aboriginal community elders and role model figures who could guide youth in understanding their connection to the land and society. Such mental health intervention embed psychiatric practice in natural settings and encourage them to seek community-based expertise in the hope of creating more resilient care system. Although this intervention may seem novel in the traditional psychiatric treatment convention, they reconceptualize care approaches to correlate them with current systemic dynamics and the current urgent for need for scaling. In conclusion, based on research highlighted today, there are several avenues on how positive psychology can be applied to address depression among Aboriginal Australian adolescents. Such studies show that intervention based on resilience, culture, and meaning can help change young people's lives. While reviewing positive psychology in educational settings, These three studies have posited as such approaches all the key to changing the stressful learning environment to a positive growth environment. They have highlighted how positive psychology is not just about learning to harvest good grades, but also the development of the entire person, the mind, heart, and soul. As educators and mental health professionals who are going to work with Aboriginal youth, we have a chance as well as duty to apply these effective practices. In this way, we can create learning context for students from culturally diverse backgrounds where students learn not only despite their cultural capital but also because of it. This discussion has given you more conceptual clarity and ideas you can use in your teaching environments. In the next episode, I'll show you how similar positive psychology principles can be used to approach the problem of anxiety in various classrooms. That was Breaking the Darkness. Thank you for joining me.